Welcome to OOTO TV, the out-of-the-office investigation from the past into the future of health. I'm Loie Pasteur, and with me is my esteemed colleague, Antoine Bichamp. Today, we're discussing a truly groundbreaking topic, antiparasitic repurposed drugs and herbs, benefits for overall health as antiviral and anti-cancer. It's a fascinating story, Antoine, about finding incredible new uses for old medicines. What if the solution to some of our biggest health challenges has been hiding in plain sight all along?
Exactly. So here's our roadmap for this journey. We're going to start in nature's ancient apothecary, then jump into what we're calling the repurposed revolution.
And critically, we'll navigate the very real controversy surrounding cancer claims, Lewis. It's vital we separate hope from hype. Then we'll get into the science, the cellular battleground, to understand how this could even be possible. And finally, chart the path forward. It's a complex but incredibly important story to tell.
So let's begin where all medicine began, in nature. For millennia, the natural world was our pharmacy. You have to remember, plants are in a constant state of chemical warfare with pests and diseases. To survive, they've developed these incredibly complex and potent chemical defenses. And now, finally, modern science is beginning to truly understand and unlock the secrets of this ancient, powerful arsenal. At the very heart of this natural pharmacy are these fascinating molecules called alkaloids. A really comprehensive review in the journal Vitae dives deep into this. Think of alkaloids as nature's special forces, Louis. They're these powerful nitrogen-containing compounds that plants use for defense, and it just so happens they have profound effects on our biology as well. And just look at this lineup. It's an all-star team of nature's best. You have quinine, which didn't just treat malaria, it literally shaped global history. Then there's berberine, a workhorse against leishmaniasis for half a century. And we're still discovering more, like liriodinine and piperine. The key point here, and it's a big one, is that this isn't folklore, Antoine. The power of these compounds against parasites is scientifically documented. They are serious, bioactive molecules. Right. And this is where the entire paradigm starts to shift. It's the central thesis of our discussion. If these plant-based compounds can so effectively defeat complex organisms like parasites, it forces us to ask a really profound question. What happens when we turn this incredible natural arsenal against even smaller, more insidious foes, like viruses or even the corrupted cells of cancer? A perfect transition, Louis. Because this idea isn't just confined to ancient herbs. Let's fast forward to the modern era of pharmaceuticals and focus on a single Nobel Prize-winning drug that has, for better or worse, become the poster child for a very powerful strategy in modern medicine. We're talking about the case of Ivermectin. And that strategy is called drug repurposing. It's an incredibly logical and efficient approach. Instead of spending 10 or 15 years and billions of dollars to develop a new drug from scratch, you take drugs we already have, drugs we already know are safe in humans, and you test them for new uses. It's like finding out your trusty family car can also fly. It allows science to take a massive shortcut. And during the COVID-19 pandemic, ivermectin became a huge candidate for this. Now just look at this data here. A massive meta-analysis published in the Medical Research Archives compiled the results from 95 treatment studies and 17 preventative studies. We're talking about hundreds of thousands of patients. The numbers are just staggering. A 62% relative improvement for treatment and an absolutely incredible 82% improvement for prophylaxis. The authors themselves concluded there was powerful evidence for its efficacy.
You're listening to OOTO TV with research by author Paul Bulow. Now, Louis, those numbers are indeed striking, but we must add a note of caution. Meta-analyses are complex, and the quality and design of the individual studies included are absolutely critical to the validity of the conclusion. It's a powerful signal, yes, but not the final word.
A fair point, Antoine, but the question then becomes, is there a plausible mechanism? And the answer is yes. In vitro, that is laboratory studies, suggest that this classic antiparasitic also acts as a potent antiviral. It appears to interfere with the virus's ability to replicate itself, and it may even bind to the spike protein, basically blocking the key the virus uses to get into our cells. So seeing this success against a virus, well, it naturally led researchers to ask a much bigger and frankly a far more controversial question. And this is where the story gets incredibly complicated. If a drug like this could be repurposed for a global viral pandemic, could it also be repurposed for something like cancer? This is where we have to tread very, very carefully and do the difficult work of separating genuine scientific hope from what can be dangerous, unsubstantiated hype. And the hype has been significant. While there are some very preliminary lab studies looking at ivermectin's potential, health organizations like the KFF are sounding a loud alarm. And they have to, Louis, because social media and certain corners of the internet have just exploded with claims of it being a miracle cure. That's a terribly dangerous label that the current scientific evidence simply does not support.
And these risks aren't just theoretical. They are real and potentially life-threatening. The FDA has been crystal clear. Ivermectin is not approved for cancer treatment. But the single greatest danger, the one that keeps public health officials up at night, is that a patient might chase this false hope and delay or abandon proven, effective, life-saving therapies. Add to that the risk of dangerous interactions with other drugs, like blood thinners, and the severe consequences of overdose, and you have a dose of reality that simply cannot be ignored.
Absolutely, Antoine, and that's why our approach has to be about targeting antiparasitic repurposed drugs and herbs, benefits for overall health as antiviral and anti-cancer, by looking at all the evidence. We have promising signals on one side and stern, necessary warnings from regulators on the other. It's our responsibility to hold both of those truths at the same time. The full scientific picture is still developing, and every piece of this puzzle is essential if we're going to get this right. So, this raises the critical question. Is there a plausible scientific reason, a biological mechanism, why an antiparasitic could actually work against cancer? Well, it turns out there is. A brilliant paper in Frontiers in Pharmacology zooms right in on a specific target, a battlefield that exists deep inside our very own cells.
And that battlefield, Antoine, is the mitochondria. We all learned about these in high school biology, right? They're the powerhouses of our cells. But in many types of cancer, these powerhouses go rogue. They get hijacked and rewired to produce the enormous amounts of energy a tumor needs to grow uncontrollably. But, and this is the fascinating twist, that unique dysfunctional wiring also creates a fatal flaw, a specific vulnerability, an Achilles heel that can be targeted. The strategy is brilliant. It's like cellular sabotage. First, an agent that specifically targets mitochondria gets inside the cancer cell. Second, it essentially pulls the plug on the cell's main energy production line. Now, this causes a huge, sudden surge of highly destructive molecules called reactive oxygen species. You can think of it like a burst of cellular rust that causes catastrophic damage. And that damage is the final signal that tells the cancer cell to initiate its own self-destruct sequence, a process called apoptosis. It's elegant, in a way. You're listening to OOTO-TV with research by author Paul Bulow. And now, Antoine, for what I think is the most incredible connection in this whole story, we are about to build a bridge that connects this cutting-edge cancer research all the way back to the ancient apothecary we started in. Do you remember pepperine, that alkaloid from the Piper plant we mentioned earlier? I do, Louis, and here it is, laid out perfectly. On the left, we have the Vitae review confirming the piperine is a proven parasite killer. And on the right, the Frontiers paper on cancer biology shows that piperine triggers cell death, apoptosis, in cancer cells by attacking that very same ROS mitochondria pathway. It's the same molecule targeting the same cellular machinery to fight two completely different enemies. This isn't a coincidence, Louis. This is a fundamental biological pathway at play. Exactly. What we are witnessing is this stunning convergence of evidence from totally different fields. We have ancient botany, modern drug development, and cutting-edge cellular biology, all pointing to the exact same conclusion. The reason we are targeting anti-parasitic repurposed drugs and herbs, benefits for overall health as antiviral and anti-cancer, isn't based on a hunch. It's because we now have a deep understanding of the cellular mechanics. These compounds work because they exploit a fundamental weakness in the energy systems of these diseased cells. So, with all this information, where do we go from here? It's crucial that we step back and look at the path forward, carefully balancing the incredible potential we've just discussed with the very real responsibilities of science and medicine. This really captures the central challenge. We are walking a tightrope. On one side, you have the peril of misinformation, where public enthusiasm and personal anecdotes outpace the hard scientific proof. But on the other side, Louis, is the incredible promise, a future where we find faster, cheaper treatments hiding in our existing pharmacies and within the vast, untapped library of nature. The only way forward is to champion the research with urgency, but to always demand rigorous, high-quality, controlled evidence. And perhaps this brings us to the most important takeaway of all. These compounds, as promising as they may be, are not magic bullets. They are powerful tools, yes, but any tool is only as effective as the environment in which it's used. And that environment is the human body.
As the slide says, targeting antiparasitic, repurposed drugs and herbs benefits for overall health as antiviral and anti-cancer, requires you to have a health plan, diet and daily eating and sleep routine, and process to provide the desired gut microbiota result for health. A foundation of good diet, restorative sleep, and a balanced gut creates a resilient body. And that resilience, that healthy terrain, is what allows any therapy to have its greatest possible effect.
A powerful point to end on, Antoine, which leaves us all with this final, fascinating question. As science continues to unlock the full potential of these ancient remedies and modern repurposed drugs, as we bridge the old world with the new, are we witnessing the dawn of a new, more integrated age of medicine, an era that could be smarter, faster, and more holistic than anything we've seen before? The research certainly continues, and it is a thrilling time to be watching. Thank you for joining us on OOTO-TV.